Thank you so much. I appreciate your patience. My name is Beth Lindborg, and I'm the CEO of Sarcio. We chose the name Sarcio because it means repair and restore in Latin. And our vision is to repair and restore a patient's cartilage using our stem cell-derived cartilage cells. Osteoarthritis occurs when the hyaline cartilage protecting your joint degenerates and wears down over time. It affects over 32 million Americans. It costs 185 billion US healthcare dollars per year. And this doesn't include things like time off work and potential addictions to opioids after surgeries. So there are 3 million newly diagnosed patients that have osteoarthritis every year. And the severity of this disease causes 1.8 million patients to undergo these viscosupplementation treatments, and they're injections that are aimed to delay joint replacements. And there are over 700,000 knee replacements every year. And we really feel that our market is in between these two treatments. And our goal is to capture these patients before they're in dire need of a joint. So these are the cartilage cells that we've grown in the laboratory. They resemble young, healthy hyaline cartilage, and most importantly, they secrete type 2 collagen. And that's really important for joint function. And like many scientific discoveries, we really discovered this by accident, and we feel a strong obligation to bring it to patients. Our minimum viable product is going to be an easy-to-use, off-the-shelf injectable product. We've developed a team comprised of business, scientific, and medical expertise that are well positioned to bring this product forward. Over the past 2 years, we filed 2 patents, received $300,000 in grant funding, and more recently signed on our Chief Medical Officer, IP, and regulatory consultants. Our benchmarks are really tied to our use of proceeds for our raise that will be starting in January of 2021. Our goal is to begin our first animal studies, lay out our regulatory strategy, and strengthen our IP position. So our $500,000 raise will begin January 1st, and I'm leading the round with $25,000. We have $80,000 in commitment so far, and $55,000 are from insiders. Thank you.
Thanks, Beth. Great job. Great job. So I'd like to invite the judges that are microphones on.
So Beth, have you actually made contacts with some of your prospective customers to validate that they want your product, and importantly, how charge them?
Yeah, that's a really good question. So far we've engaged our Chief Medical Officer, Dr. Mark Tompkins, and he's really the one that's helping us get into contact with other orthopedic surgeons to talk to about this. And we have done a lot of voice of the customer research as well, and have found that there really is a need for this. People are looking for something like this in the market. And I think what's important is if you think about a joint replacement, they only last about 15 to 20 years. And so when you're, 66 years old, 67 years old, and you need a knee replacement, you're going to push it off as long as possible because you don't want to be 80, 90 years old undergoing a second knee replacement. So that really is the a big need in the market. And if you look, I have this, you probably can't see it, competitive, advantage slide where we really are offering a permanent, where our goal is to offer a permanent solution. One of these items here, PRP injections, right now, those are on the market. You may have heard of those. And that's actually a cash market right now. And those are going to up to $8,000 an injection for cash. So we would hope to be a reimbursed product that, where we have really good clinical data that shows real efficacy.
Beth, you said the sandwiches between the 2 treatments. What would be the expected patient benefit? What would they see by having this product?
So our goal is to replace and restore a patient's cartilage and provide them pain relief and proper joint function.
And you said you're looking for this as a permanent, potentially, as you go down the road and to avoid knee replacement?
Yes.
hate to follow them, but what evidence so far do you have to suggest that might be the possibility?
Right. So right now we have really nice looking hyaline cartilage cells that we're growing in the lab, and our goal is to further develop and de-risk the technology with animal studies.
Thank you.
You emphasized osteoarthritis in your presentation. Can you speak to the applicability to other diagnoses beyond that?
Yeah, I think this has a lot of potential for cartilage injury repair, but since O is the bigger market, that's where we want to start.
Thank you.